Assalamualaikum viewers, welcome to our health related shows. Another episode Bangkok Hospitals presents Health Talk. I'm your host Nusrat Jahan Deepa. Viewers, today we are very honored to have a special guest joining us from Bangkok Hospital headquarters, Thailand. Viewers, today we have with us Dr. Paweena, IVF specialist, and Dr. A-jaree, gynecologist. Dr. Paweena and Dr. A-jaree, welcome to our show. And to be honest, we are very happy to have you with us. And of course, I'm looking forward to both of your meaningful and valuable discussion. Okay, now we will start our discussion with Dr. Paweena. How are you?
Good. I'm so excited to be here today.
Okay, so what is your feelings?
So right now it feels like happy and very excited.
Okay. Do you like our culture, like our foods, our culture, like our dress up? I know our food is very delicious.
I love your food and also your clothes also.
Oh, thank you so much. Okay, now I'm asking you that I'm pretty sure that you have treated so many patients from Bangladesh who've been there for IVF treatment. So could you please tell us for our audience that what are the common problem among Bangladeshi patients?
So common problem of the Bangladesh patient can be like irregular period for PCOS, pelvic endometriosis, and also in the male factor like low sperm count, low sperm mortality.
Okay, could you please tell us also those who don't know about what is IVF treatment? So could you please tell us very shortly in easy words what is the meaning of IVF?
IVF is standing for in vitro fertilization, which means we given the woman the hormone to stimulate, multiply it.
Okay.
And then we bring the egg out of the body. We fertilize with the sperm in the laboratory, resulting to have an embryo. Then we transfer the embryo back to the uterus.
Okay.
So this IVF is offer hope to the patient that's struggling with infertility in case of blocked fallopian tube, pelvic endometriosis, PCOS, or even in the low sperm count or unexplained infertility.
Now my question is globally and including in Bangladesh, infertility problems is increasing day by day. So what is the reason actually behind this, or what is your opinion?
So I think maybe the problem from the infertility, they have a lot of cost. From the most common case is the quality of the egg and the sperm is very bad from our lifestyle, from the PM 2.5, and maybe it cannot explain. But for the medical technique, it can help them to get the children what they want.
Okay, so can you please explain us how do you know that what is the quality of egg is good or bad? How do you know that?
So first, I think you need to have an initial consultation with IVF specialist so we can review your medical history. And for the female, we have to check your hormone, check your ovarian reserve blood test, and also we need to do the ultrasound to check inside that your uterus, your endometrium, and the number of the egg in the ovary to access the female fertility status. Also in the same as male, we will review all the history and we have the sperm check to analyze sperm concentration, sperm mortality, and morphology to access the men's status to have a children.
Okay, so can you say that is that genetical problem?
For genetic problem, we also do test embryo for screening the genetic problem and other chromosome abnormality.
Okay, so as you IVF specialist, I want to know that as well. Our audience also want to know that what is the success rate of IVF?
Our success rate in my clinic, Bangkok Hospital, the success rate is from 50 to 70% per cycle. In the case of women aged under 35 and the embryo is undergone chromosome check, but for the success rate, it will decrease followed by the age, particularly when the woman age is like more than 40. And it depends on the eggs and sperm quality. Also, it depends on the experience of the doctor and laboratory team. So it's best to consult and find a specialist doctor that have more experience, so it can bring you a higher success.
Okay, so is it depends on age?
Mostly the quality of the egg will drop down by the age. It's come down very fast when your age is like more than 35.
Okay. As we know that 35 age is, it's called high risk pregnancy.
Yes,
right?
that's right.
Now my question is, what are the preparation or procedure of IVF and how does long take it?
So first for the preparation, you need to educate yourself first that the process of the IVF. So when you know what to expect, the anxiety will reduce and you can make the right decision.
Okay.
Second, you need to prepare yourself and your mind to get in through the IVF process. And third, you need to find the right clinic for higher pregnancy chance. And for IVF will take time around 2 to 3 months from the starting ovarian stimulation until the end of the process, embryo transfer. In summarize for timeline, first we will do the ovarian stimulation given the hormone for every day, like 10 to 12 days. And then when the egg is ready inside, we do the egg retrieval outside and fertilize with sperm. After that, for our team, laboratory team will monitor the embryo development for 5 days. After that, we can check this embryo that is normal or abnormal. We can do the chromosome test to check that they have a genetic disease or not. And once you get the normal one, we try to prepare your uterus, take time around 3 weeks and transfer it back to your uterus. So entire of the...
You can say that it's a long procedure.
Yes, for the entire IVF process, it takes time around 2 to 3 months, but don't worry, it's all the process is outpatient case, no need to stay in the hospital.
She can stay also at their home, right?
Yes.
Okay. So I also want to know that, as you know, that since this is a corporate era, so if any couples wants to have twins, so is it possible or can it done by IVF?
Yes, for twin is possible through IVF. For the IVF, twin can occur when we do 2 or multiply embryo transfer back to the uterus, but the result is not guaranteed because they have many choices that influence during the process treatment.
Okay. So is it possible as well triple?
I think triple is possible, but I think in a long term for the baby life, it can be dangerous.
Okay, so now my question is, can PCOS or irregular period in women or teenagers can lead to infertility?
It's hard to say it can or it cannot be, but mostly it can be because when you get a PCOS, your egg is not spontaneous ovulate. When you're not ovulate, you having sex is not conceived.
Is there a direct relation or indirect relation?
It's mostly direct relation because you not ovulate. So they're not something is not fine with the sperm. So it can bring you to infertility in the future.
Okay, that's great. So do you have any advice for our audience and your patients?
I think for the SY, I have many tips for you. First, you need to maintain your healthy lifestyle. Eat more vegetable, have more meat, and do exercise regularly. For the Bangladesh people, I need you to maintain in the normal weight and keep your mind well-being, do the stress management, and look for the right fertility clinic that have the high success rate. So you can bring all the success and make your experience as smooth as we can.
That means it's a complete package, right?
Yes.
Okay,
that's
thank
right.
you so much, Dr. Paweena, for your nice and valuable explanation. Thank you so much. Now we will start our discussion with Dr. A-jaree. How are you?
It's the first time in Bangladesh and I'm so excited like Dr. Paweena.
Okay. So how is your feelings? Do you like Bangladesh or Bangladeshi people, Bangladeshi culture, Bangladeshi foods?
fresh fruit because we already have lunch in our hotel. It's so delicious.
Okay.
And it's different from Thai food.
Oh.
But the taste is also
We love also Thai foods.
Yes.
Okay, I'm pretty sure that you have treated so many patients from Bangladesh. So could you please tell us what are the common symptoms among Bangladeshi patients?
Yes, the most common symptoms is from the menstrual disorder. This is like the irregularities, like the painful period, and also like heavy menstrual bleeding or long period of menstruation. And the associated disease with symptoms like hormonal imbalance, as you know from Dr. Paweena, is PCOS.
Hormonal
is very
imbalance,
common.
exactly.
It's common. And the second common symptoms is about the pain. It's not related with menstruation. It's like chronic pelvic pain. It's pain with.
Is it called endometriosis?
This is the disease that associated with the chronic pelvic pain that define as the pain is persist over 3 to 6 months. So it's the common disease is the endometriosis. And the third common is a mass, is the pelvic organ mass like uterine mass or ovarian mass. That is the consultation from the check-up center. When Bangladesh come to Thailand and check up and they accidentally found the mass and sent to our center, or the patient come with the symptoms or have a second opinion, ask about the treatment options.
Okay, what is your opinion about overweight or obesity? Is that the main reason or lead to infertility?
It's related, but it's now people have getting overweight. Is the problem is the hormonal imbalance, and is the also direct and indirect of the ovulation problems.
So what about thyroid-related problem?
Thyroid problem is also same like in Bangladesh, but it's a problem mostly is the hormonal imbalance, and also is problem with the mass, the cyst, and also endometriosis. Now is the trending of the increasing the rate of endometriosis.
So we can say that a hormonal imbalance or thyroid-related problem can related or connected to infertility, right?
Yes.
As we know that you are specialized in pelvic pain management and minimally invasive surgery. So could you please tell us more about it and what are the update technology? Do you visit Bangkok Hospital?
Yes, first I'm gonna explain about the pelvic pain first. Pelvic pain treatment option is based on the biopsychological and multidisciplinary approach, and it's individual treatment. So first of all, we have to have the history taking by gynecologist about the characteristic of pain, and also referral pain, and also associated with organs like the urination and like the constipation that may cause of chronic pelvic pain. And so the imaging modalities we can offer like the very basic is like the bedside pelvic ultrasound. And the second is the CT scan of the whole abdomen to find out the cause. And the third is the very helpful now is the MRI. Magnetic resonance imaging. So it's the helpful because of, as we talked in the first question, is endometriosis now is trending. So MRI can detect endometriosis related symptoms like pelvic nerve involved with endometriosis. The patient can cause like the pain that radiates to the thigh, to the leg, and to the lower back. And maybe they have a problem with the bowel bladder, which is involved with the pelvic nerve with endometriosis. Or the deep infiltrated endometriosis. It is like the endometriosis that go deep to the rectum. And the patient have a problem when they got menstruation, and they have a problem for passing stool. And or maybe if the endometriosis go deep to the bladder, which is close to the uterus, and it can cause the bloody in the urine.
Okay. Could you please tell us more about endometriosis? What is the symptoms of endometriosis?
Yes, endometriosis, the mechanism of disease is like the endometrium. Normally, endometrium is the tissue that inside the pelvic cavity, but it's going to stay outside on the over of the outline of the uterus, and or maybe go to the ovary can cause the cyst. That is common. We say that chocolate cyst, the same, and also they can go down to the pelvic floor, and to go deep to the adjacent organ like bowel, like rectum, and go in front to the bladder. And so it can cause the most common problem is the dysmenorrhea.
This is also called chocolate cyst, right?
Yes, yes.
So what is the treatment actually?
Treatment actually that we have multidisciplinary. First of all, we try to find where is the endometriosis site, or maybe some patients have more than one side, uterus, ovary, or down to the pelvic floor. Second, we try to use the medication first, because most of patients is like the reproductive age group. They need to have a baby, so we try to use medication first. And if they really need on that time to have the baby, we will send to Dr. Paweena for helping us to treatment. And the surgery we'll do if the patient have seems to be a problem with the mass, if the big mass like 8 centimeters, it can cause complications like rupture or like infection, so they need to receive surgery. Or in some cases that we suspected of malignancy, so we have to do the operation.
Is it necessary surgery?
It's not necessary for surgery on that time of diagnosis, okay. But we have to follow
Depends
up.
on condition.
Yes, it's condition, and it's like the life, whole life of treatment. The treatment will be stopped on or will be postponed if the patient have a menopause period, because of the endometriosis related with the hormone of the ovary.
Okay, thank you for a nice explanation. So if any patient wants to have a regular gynecological related checkup from Bangkok Hospital, so usually how long they need to plan to stay in Bangkok?
Oh, okay. So about the early gynecological checkup is depend on by age group.
Okay.
We're starting with the age of 20. And to the menopause period. So about the test that we offer for the patient, starting with the taking history by gynecologist to ask about the problems, menstrual, family history, and also any problem with the area of pelvis. And second, we do the pelvic examination and to collect the cells that that we can. Right now, it is a recommendation to have cervical screening, cancer screening. So it's collect the cells when we do the pelvic examination, starting with the age of 20. Or if the teenagers, they have early age of sexual intercourse, or if they have, they should receive the checkup.
But that will be, I think, a high-risk pregnancy, right?
Yes, but it's like about cancer, cervical cancer is related with the age of the first sexual intercourse. If they're very young, so it's take the high risk to get the problem with the cervix.
Thank you for a nice explanation. Now, do you have any advice for our audience and your patients?
For me, it's my part. I'm a specialist in gynecologist and also oncologist. So for me, it's like the concerning symptoms that I want to make a notice to the in general population that if if you have the problem with the irregular menstrual irregularities or painful period, which is the disturb in your daily life or quality of life, that is significant to visit the doctor. And also like the gynecological checkup. It's important because of we found a lot of cases that they found the disease when only check up. From the ultrasound, we found the mass, the cyst, and the need. It's not only for just found, but it receive treatment.
Okay, so we can say that in any disease, we should maintain a disciplined lifestyle, right? Okay. So, Dr. Paweena and Dr. A-jaree, thank you for your nice advice and thank you for joining with us in this show. Thank you again.
Okay.
You're
Thank you.
welcome.
You're welcome.
Dear viewers, that's all for today. To stay healthy, you should prioritize a balanced diet, good food habit, proper sleep, and maintain good hygiene. Until next time, take care and stay blessed. Allah Hafiz.